Hey everybody, Dave Howard here with Tyson Gabriel. We're coming to you from the downtown Phoenix compound of PRM, Risk Management. We want to talk about some things over the next few weeks that are coming up, and you're going to see these random videos coming from us on our YouTube channel, and we'll give you some information how to get to that later. We're going to start out with just asking a few basic questions, and then Tyson's going to walk us through some facts that we don't think are being told to the general public. And at the end, we'll leave some information so you can get a hold of us either through email or on our website or even our telephone number. We would love to hear from you or hear any input that you have. So Tyson, I guess let's start with, we had a virus.
Absolutely.
And what was it? Do we know?
What we do know is that it's from the family of coronaviruses, much like the SARS outbreak that we had in the early 2000s. There's still a lot of things that we've learned about it, but what we do know about it is that it's highly contagious. It attacks your respiratory system, and also, but it's a fragile virus, which means it's easily decayed. For example, it has a layer of fat around it, which decays in ambient temperatures above 77 degrees Fahrenheit. These are little facts of the virus, of its capability, that I think the public should know to understand its weaknesses, its strengths, and how to best protect themselves against it.
So one of the things that I think frustrated most people, and we got a lot of phone calls about, was what do we do? You know, what is it? They're telling us to wear a mask, don't wear a mask. They're telling us to stay home, don't stay home. That's not going to help, this will help.
Right.
And we all understand the hierarchy of controls, but let's go over the hierarchy of controls. So a lot of people really don't know what that is.
Yeah, the hierarchy of controls. So our background is we're environmental health and safety professionals, and what we're trained to do is we look at understanding exposure points, risk points that people would have in the workplace, at home, in general, the environment. And what we do is we use the hierarchy of controls as a means for us to look at opportunities to better protect people. So it's a system of eliminating the hazard, substituting the hazard, engineering controls, administrative controls, and personal protective equipment. And in that order is from most effective to least effective. All right. So when we talk about the elimination component of this, really, it's going to be very difficult. But you've seen it in the workplaces where they're having people work mobily. So you're not going to the workplace, you're not risking contamination or outbreaks. That's a great elimination. In this situation, there's no substitutions, but an example of a substitution would be, say you have a chemical that cleans engine parts, it's got carcinogens in it. You switch to a different chemical that's maybe has acid or fruit acid in it versus carcinogens, has the same effect, but it doesn't toxify the work environment for the workers. Next, we go into engineering controls. And engineering controls, their design is to take away the human element. So it's in place while you're working, and it's protecting you without you really having to give it much effort. One example would be the HVAC system that all buildings have. Oh. That's a great control, especially for this virus, that it's used to get air changes out, and also mitigates the virus from the work environment or living environment. Then we get into the administrative controls, and this is where, and again, administrative controls, engineering controls, far more effective than personal protective equipment, and we'll talk about that in a second. But administrative controls, you see that in the field or in the industry or out in the work environment, is washing your hands. Basically, what an administrative control basically is that it's a policy change or policy and procedure that alters behavior or enhances behavior to better protect people from exposure. So hand washing, social distancing, those are the common things that you see for administrative controls dealing with this virus. But then personal protective equipment is what you have when nothing else is available, or if those things, basically if you're like in a laboratory, for example, and you're not able to go behind a plastic barrier, you're not able to do anything of that nature, and you're in direct contact with a contaminant, then PPE, personal protective equipment, is your only option at that point. But again, it's always least effective because PPE in general also has associated risks.
So it's kind of like with every other behavioral science that we look at, or safety,
Yep.
whatever it is, PPE is our last line of defense.
Absolutely,
always.
Absolutely. And if you make that the centerpiece of your exposure prevention plan, you're setting yourself and your people up for failure. And that's one of the most frustrating things that we see coming from politicians and even the public health sector, which should be trained in this, they're so hypersensitive on PPE that they're not coaching and training the public on better means of control. For example, I have a friend of mine, and she, at work, she has a plastic barrier between her and her clients. With that barrier, that's considered an engineering control, which is far superior than administrative controls or PPE, and she's not wearing a mask because she has that engineering control available for her. She had a client come in who essentially got in her face a little bit for not wearing a mask.
Wow.
But totally uneducated and understanding that that barrier is a better protectant than the mask. So these are things why I think we need to start, the environmental health and safety professionals as being the ones that are actually trained in this, we need to start talking more around the country to help educate people or clarify things as you talked about earlier, so they're not in these contentious situations without really having a full grasp of the knowledge that they're trying to spew.
That makes sense. So to help people out that might run into this video that we're going to put out, we use science.
Yep.
Actual studies, information that has been around for years.
Decades.
And that continues to
Absolutely.
advance. It's a constant evolving thing, especially the different universities have different programs. And we're in tune to what they're doing, and we listen to what they tell us, because it's a test. It's a
Right.
scientific test. And I believe they call them RCTs, is that right?
Yep, randomized controlled trials. These are great things that we use. I love using them. It gives me a baseline of understanding whenever I'm recommending someone to wear certain types of protective equipment, or trying to figure out what decisions they need to make for their type of work environment. And I love using RCTs to validate those decisions. And in fact, this year we have some really good ones that relate to the COVID-19 outbreak. So,
well, share some with us.
Yeah, absolutely. So I found one. It was published in June. It's from the Public Health Ontario in Canada. And basically what they did is they took studies from all around the world that were happening as it related to wearing masks during the pandemic. What were the benefits? What were the situations that you should wear them in? And for me, it helped give more clarity as to what I was hearing from the public health officials that like Dr. Fauci or people like that. What they started telling the public in May was totally against the grain of all the training that I've ever received. And so going to these RCTs, I was curious, is there something new? Is there some kind of new development that I'm not aware of? And in looking at the RCTs, there's nothing new. It's just the doctrine has changed for some odd reason. But and we'll have a link to get this RCT, but the key points of the RCT came out and said that public mask wearing is likely beneficial as a source of control when worn by persons shedding the virus, which means you got to be symptomatic.
Correct.
Now, there is an argument to be said right now where there's a possibility that someone who's asymptomatic could be a carrier. There's no firm evidence of that, but what we do know from history of all pandemics, outbreaks, viruses, is that unless you have some kind of means of spreading it through symptoms, you're not an efficient spreader. So the likelihood of you being somebody who's spreading it is very far and few between if you're asymptomatic. So, which is why they specified here in RCT if you're shedding the virus.
Okay.
Because that's an obvious one.
That makes sense.
Yep. Then this is an interesting one too. There is emerging data from ecological studies showing a decrease in new COVID-19 cases in regions where mandatory public mask policies were implemented compared to regions where such policies were delayed. However, there may be confounding by other public health measures. So I like that one because if you go to page 4 of the same RCT, it says no significant benefit from wearing masks was identified. Wow. Studies that demonstrated a benefit were associated with enhanced hygiene measures.
Wow, there's the science.
So if you look at this, I know one of the comparisons that people talked about is Japan. They've had success with this. The Japanese are extremely hygienic. They're very, very strong with hand washing, but also they don't. One of the main measures of entry for a virus into your environment is your shoes. They take their shoes off before they go home. They take their shoes off before they go into a building. So Yes, they've been wearing masks, but the Chinese have worn masks for years because of the poor air quality where they live.
That's correct.
And some of the worst contagions come out of China. So clearly, the mask use isn't the means of which it's being prevented. But also in here, they mentioned that there was a study in Denmark that still hadn't been completed. Well, that got completed August 3rd, and this is their finding in the mask use in Denmark. The use of facial masks outside the healthcare system is not recommended by the Danish health authorities.
Wow.
So, I don't know what we're doing in our country, but apparently we're not doing the kind of research that they are in Europe. The third main key point from this RCT from Ontario, masking to protect the wearer is unlikely to be effective for non-healthcare settings.
Wow.
Okay. Medical masks should not be worn by the public to avoid shortages of PPE for healthcare workers. There is some variability in the effectiveness of homemade and cloth masks, which is interesting that they would say that because we have an RCT from back in 2015 with the Vietnamese healthcare industry where they actually experimented with cloth masks to see if that had any benefit.
Really?
It turns out that moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. So again, this data is coming from this randomized control trials going on all around the world and in the healthcare settings, and these are things that we've known for a number of years. So this goes back into, I don't understand why they're talking about cloth masks. And also the Duke University did a great study on, I believe it was 14 different types of masks, where they found that the fleece mask, one that people are wrapping around their collar, and is actually breaking down large droplets and causing exposure to be 110%. So you're actually better off not wearing a mask than one of the fleece covers around your neck. Also, what we're finding in these studies is that cloth masks, it retains moisture, which attracts bacteria. You know, if you have any kind of airborne contaminants, you're going to be exposed to that at a higher rate by having something over your breathing apparatus that's attracting it at that level.
So I have a question for you.
Yeah.
So all this information, all this data, and I'm sure there's going to be more testing being done.
Yep.
And you know, in a couple of years, we're probably going to have more information about this, but of course, we will have evolved into other issues by then. So one of the things that I come back to, and I think we've discussed this before, is when you listen to people, especially on TV, and they're constantly changing what they're doing, I start to think to myself, you know, it kind of sounds like when I go to see a doctor and they're like, take this pill.
Right.
And then you go back and, you know, I'm not really doing any, but okay, well, let's try this pill or this treatment, and they're looking for the right treatment. They're making a best effort to help or correct the situation. But is there a term for that in our world that people need to be aware of?
I call it the faith-based science. All right, so you have actual science where you got hard data, you got hard numbers, you got things that you can go to, you got key findings from that research. But then you have guessing games like what you're talking about here, where the doctor will say, and I experienced this myself anyway for some of the personal medication I've had to take in the past, where we'll go through different types and different dosage amounts to see if we're getting the right result. And that's really what we've been seeing here with the mask use is they're hoping for, to achieve something, and they're guessing that these things might work, and that's why they're imposing it. And you get a scientist up there saying, yes, this is what we should do. General public media will say, the scientists are telling us to do this. But they're not showing methodology, research, any of those findings. And again, we have decades of this.
Yes.
And all of a sudden it's turned on its head, which doesn't make any sense to me. And we see that in other, you take a scientific theory or hypothesis, and they can't prove it, they can't disprove it, but they'll say, I feel real strong about it, so they're going to have faith and believe that hypothesis is true. But without data facts, we just don't know. So You see this a lot with the doctors, and they're recommending different types of means for exposure prevention as they do with like medications and things. But it kind of goes back into, they're actually not the experts on this. they're not the ones that get the training on this. As you know, we're actually hired by medical professionals to train their staff on
all the time.
All the time, and we conduct fit testing, respirator training, things of that nature. So they're the ones that come to us to get that information, because we're the ones that we go through all. My background, I have a degree in environmental science and safety engineering, so we study all the reports from NIOSH, from ANSI. We understand what works in what situations. We read the RCTs to understand environmental controls while you're wearing certain protective equipment to make sure that it fits what their needs are. You saw evidence of that with early on in this pandemic. Dr. Lee from China, the brave guy that was eventually he contracted the virus and died. But the videos that he was producing, the first thing I noticed was improper respiratory protection use. He had a face mask and then a respirator on top of that. Well, wow. With the face mask, you're not getting a seal. Mm-hmm. So you're leaving yourself wide open to exposure. And he was in a high-risk area where he's dealing with infected people all day. Unfortunately, that probably was one of the contributing factors to him being infected.
So it's kind of like what we used to say when we saw people starting to put face coverings on their face, and we would say it's a virus. And if you look at the scientists that are actually dealing with the virus, they have a tremendous amount of equipment on. They're working in temperature and environmental controlled rooms, certain amounts of air exchanges, certain filtration systems. They have a whole different level of PPE on, because that is what they have to go to protect themselves from the virus. So that's a very good point. So hopefully, we'll start to get some information out, and we're looking forward to hearing from you. And we just want to take a moment and thank Tyson for spending some time this morning.
Great to talk and answer his questions. It's these rants would go on in the office, so it's good to get it out and have the conversation.
Watch for future publications. There'll be a lot of information out there. We're going to post information at the end of this where you'll be able to get a hold of us. You can go to our website, call us on the phone, email us. We'd love to hear from you, and we'll see you again really soon.
Talk soon.